Every year, millions of men and women quietly lose something they never thought they'd miss until it's gone. Hair loss isn't just a physical change, it's a confidence killer, a silent erosion of identity. Hair loss affects over 85% of men by age 50 and nearly 50% of women at some point in their lives. But not all hair loss is the same. The most common type is androgenetic alopecia, better known as male or female pattern baldness. It's driven by genetics and a hormone called DHT that slowly shrinks your hair follicles until they stop growing altogether. Then there's alopecia areata, where the immune system mistakenly attacks its own follicles, leaving patchy, unpredictable bald spots. Traction alopecia, caused by years of tight hairstyles pulling constantly at the roots, and telogen effluvium, a sudden dramatic shedding triggered by stress, illness, or hormonal shifts. For men specifically, surgeons use something called the Norwood Scale, a 7-stage map of hair loss progression that determines exactly where you are and what can be done about it. So, are you a candidate? The ideal candidate is typically between 25 and 65 years old, with stable hair loss, meaning the balding pattern has settled. It's not still actively spreading. The donor area, permanent band of hair at the back and sides of your head, must be healthy, dense, and large enough to harvest from. This hair is genetically resistant to DHT, which is exactly why it's used for transplantation. Now, not everyone is ready for surgery immediately. If you have active autoimmune conditions, severe scalp disease, or you're under 25 with unpredictable loss patterns, your surgeon will likely recommend starting with PRP therapy, medication, or laser treatments first. Surgery is the destination, not always the first step. Today, there are 3 primary hair transplant techniques. Each one has its own logic. The first is FUT, follicular unit transplantation, the original method. A thin, horizontal strip of scalp is surgically removed from the donor zone at the back of the head, then dissected under microscopes into individual grafts. FUT allows a very high graft yield in a single session, making it ideal for advanced hair loss cases. The trade-off? A permanent linear scar at the donor site. The second, and now the world's most popular technique, is FUE, follicular unit extraction. No strip, no linear scar. Using a micro-punch tool less than 1 millimeter wide, individual hair follicles are extracted one by one, directly from the scalp. Over 75% of hair transplant patients globally choose FUE today. Minimal downtime, maximum discretion. And then there's DHI, direct hair implantation. The next generation, DHI, uses the same precise FUE extraction technique, but instead of creating incisions first, each follicle is loaded directly into a Choi implanter pen and placed into the scalp in one single motion. No pre-made holes, higher density, less trauma to the scalp, faster healing. It's not just a procedure, it's precision engineering applied to your hair. Here's where the numbers get real. How many grafts do you actually need? If you're at Norwood stage 2 or 3, early hairline recession, you're typically looking at 1,500 to 2,000 grafts. Stage 4, moderate balding, 2,500 to 3,500 grafts. Stage 5, advanced loss, 3,500 to 4,500. And stage 6 or 7, the most extensive cases, can require anywhere from 5,000 to over 7,000 grafts, sometimes across multiple sessions. But here's what most clinics won't tell you up front. A skilled surgeon doesn't just plan for where your hair loss is today. They plan for where it's going over the next 10, 20 years. Preserving your donor supply isn't just smart. It's the difference between one great result and a lifetime of options. Here's what separates a good hair transplant from a truly great one. The hairline design. A natural hairline is never perfectly straight. Look closely at anyone with a full head of hair. There's irregularity. Micro variations in angle, direction, and density. The very front edge has the finest, softest, most wispy hairs. These are replicated with single hair grafts, placed individually by hand. Behind them, 2 hair grafts, then 3. Building density progressively, naturally. But placement alone isn't enough. The angle of implantation matters just as much. Each hair must be set between 10 and 45 degrees, following the exact natural direction of growth for that zone of the scalp. So, when it grows out, it lays flat. It blends in. It moves exactly like the rest of your hair. Pause. This is surgical artistry.